Health authorities at Asuogyaman district of the Eastern region are alarmed over the high cases of Bilharzia recorded this year. In 2022, the Bilharzia cases stood at 22, but has since jumped to 75, representing 240% increase. The parasite that causes Bilharzia enters the skin once individuals come into contact with contaminated water. We'll hear from the District Director of Health shortly, but first, take a listen to the Member of Parliament for the area, Thomas Ampemdakon, expressing worry over the increment in Bilharzia among the people.
Indicates that Bilharzia is on the rise, but I do not know if that is a direct consequence of the spillage by the dam. I don't think we have any evidence to that. But it is worrying to realize that in 2021, we recorded 15 cases. In 2022, it increased to 25. But as of last week, 2023, we have recorded 75 cases. And so that is a worrying trend. And so we have intensified education in the communities along the Volta, so that they stay away from direct use of the water from the lake. And so this is what I was talking to them about, and I have tried to put in some interventions that will give them alternative source of water, because most of them depend on the water from the lake, and so it is a worrying situation.
He was also unhappy about the unresponsive posture of NADMO after 160 persons were displaced following the Akosombo Dam spillage.
You know, the spillage started from my constituency, and so some communities very close to the dam recorded some incidents. So there were basically the buildings that are made of mud collapsed, and we have about 50 of such homes that have collapsed, displacing the statistics from NADMO, about 160 persons have been displaced. The greatest effect in my constituency, as I put it, is with the cages in the water. The fish farms that are in the lake have all been destroyed. Cages have been moved, nets have been torn, and all the fishes have escaped, and lots have died. And that is a huge loss to the people there. And it is a worrying situation that we are all trying to contain.
We can now speak with the Asuogyaman District Health Director, Rebecca Bante, for more on the rise in Bilharzia cases. Dr. Bante, grateful for your time. First, what could be accounting for the high cases in Bilharzia this year?
Okay, thank you very much. Bilharzia is a water-related infection or disease, and it usually occurs in areas with fresh water bodies. So Asuogyaman finding itself along the Volta Lake, and Bilharzia has been endemic in Asuogyaman. But looking at the numbers, as you rightly said earlier, or said by the MP, the numbers are increasing. Why? Because sensitization has increased and case death has increased. But I wouldn't say that it is directly related to the spillage or the flooding. However, now that the water is very close to the people, and then they frequently get into contact with the water, then and I see that we stand a chance of probably getting additional numbers.
So what interventions are you putting in place, to curb the spread, since you say it's contagious? Okay,
thank you very much. So now, in collaboration with VRA has its role that it plays with vector control. If we want to go into the site of how the disease comes about, how the mode of transmission, we'll get to know that there is a vector, the freshwater snail, that hides along the banks and weeds that are closer to, along the water body. So VRA does that by removing all these weeds from time to time, and they also support the district with drugs that we frequently give out to school-going children and then some communities. The same way, Ghana Health Service is also supporting us with drugs that areas that are identified as having higher prevalence rates. We give what we call mass drug administration using praziquantel to ensure that adult worms are killed. So all that the district is doing is creating awareness for people to try as much as possible to avoid coming into contact directly with the water, because you can only get infected when you wade through the water, you swim, or fetching water, you come directly into the water, then the infected bacteria penetrates your skin. So if you avoid coming into contact with the water, then you are likely to prevent yourself. Also, those that depend solely on the water body, from the water from the lake, they are advised that either they boil the water or they sieve the water before they use it. So now sensitization and then hygiene practices and then mass drug administration are the strategies that we are using to keep the disease down. Also, for people not to sit at home anytime they have the symptoms, because awareness is created. So when they are sick, you seek help, medical help, as early as possible. So those are the strategies and many others that the district is using, in addition to support from VRE and the Ghana Health Service to ensure that the disease is kept. Thank you.
Rebecca Bente is Asuogyaman District Health Director. Grateful for your time. Meanwhile, the Director General of Health, Dr. Kuma Boaji, has disclosed that psychologists will be deployed to flood-affected areas to provide victims battling with trauma following the dam spillage. Take a listen.
And we also mobilize our friends and some pharmaceutical companies to bring donations, including water, medicines, etc., not only to you, but to the entire community that have been affected. The regional leadership too has also been able to mobilize resources from other in the region and other districts to come in here and provide support at all the levels. Okay. We know that there have been psychological trauma, and so we have also engaged our psychological society, and I believe that this week they will also be here with their mental health team to ensure that they provide you the necessary psychological support as they are to be.
Well, joining us also on the line is Volta Regional Director of Health, Dr. Senokwesi Jokoto, because we understand the Bilharzia disease is prevalent there as well. Mr. Jokoto, grateful for your time. What's the situation in your area?
Thank you very much. Let me first clarify my position. I'm the Deputy Director of Public Health for the Mocha Ghana Health Service. My regional director is Dr. Santos Kubio. I listened to the district director for Asuogyaman who eloquently spoke about Bilharzia. I think most of that applies to us here in the Volta region, but what brings it into context is the fact that since we are all monitoring the case conditions over the past 2 weeks with regards to the effects of the flooding, we also noticed some Bilharzia cases. But I would say that, like was said earlier, these are disease conditions that are endemic in communities along the Volta Lake. Time there's been a lot of strategies to try and reduce the number of cases. We've had support from Ghana Health Service. We've had a lot of support from VRA as well. Even as I speak, we are also going to do the mass drug administration in all the communities along the Volta Lake within the Volta region that we're using praziquantel. We are also intensifying risk communication and social mobilization so that people know when to come into contact with, what to do when you come into contact with water that are infested by bacteria. So I'd like to say that within the past 2 weeks, yes, we have seen cases of Bilharzia, but they are not related to the floods that we are currently experiencing.
Are there plans to help the situation?
Yes, and the interventions are being intensified all across, especially because of the flooding. We know that the water has come closer to people. More people are going to get in close contact with the vector that would transmit the Bilharzia disease. So definitely we have to take extra measures and intensify what we are doing already to ensure that more people do not forget Bilharzia or cystic.
Dr. Jokoto, I'm grateful for your time. He's the Volta Regional Director of Health, and he says there's intervention to help curb the spread of Bilharzia there. Earlier, you heard the Health Director of the Asuogyaman District also saying that they're doing well to ensure that they reduce the infection of Bilharzia. Now,